Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. This is yours truly, Helen Nguyen, back in the studio after a bit of a break. So many things going on, right? We're coming into the holidays and it just seems like the world is up in flames. But guess what? Today, we're going to be talking about a really interesting topic, and hopefully we can just put the dumpster fire on pause and tune into this podcast together. And I ran across a really wonderful magazine that I've been reading for a long time now. And there's an article in it. And yes, I'm very old school. I like to read on paper and it's not digital. But there was this really cool article called "How Can We Help Close the Maternal Health Gap?" And it's by this author named Cassondra Moriarty. So sorry if I butchered that, but it really got my juices flowing. It really got me thinking about maternal health, about women's health, and how it ties back to 3W. And so I just wanted to walk through this article with you and just kind of point out some of the things that really stood out to me personally and professionally. And the tagline to this article is "Mothers and children deserve better." And I cannot agree more with that tagline. So let's dive into this article. By the way, we'll have the link to the article so you can read it yourself when we release this podcast. But right off the bat, the first sentence is, "Despite the fact that America spends $111 billion, B with a B, annually on maternal and newborn care, twice as much as other high-income countries, we have the highest maternal death rate of the developed nation." Okay, let's let that marinate for a little bit. We spend the most money annually on maternal and newborn care, and yet we have the highest maternal death rate of the developed nations, okay? So that right off the bat is just so concerning to me, right? How can we be spending this much money, and yet we have the highest maternal death rate, right? So it's obviously a very complex issue. We're just going to be scratching the surface of this, but I wanted to highlight some of the talking points of this article, right? So this author was saying that the maternal health gap is very multi-layered. One of the things that she's presenting is structural racism in healthcare education practices, historical and economic forces like financial barriers, and communication skills. So she's pointing out that healthcare is perpetuating structural racism, and there's disparities between cultures and religion, and all of that is not taken into consideration in the healthcare system these days. I've done a podcast kind of exposing racism towards my grandmother when she was unexpectedly sterilized with her last child. And that is definitely due to someone in power, someone who felt like he had the right to choose for her without her consent, right? I can totally see that as part of the maternal health gap issues that are coming up in our country these days. This was like 40 something years ago. It's still happening today. I know that it is. I totally understand that being in healthcare, I've seen the lack of resources for those that have language barriers, that have cultural barriers, that have financial barriers to access good healthcare. I've seen that just being a part of 3W. So I totally concur with this author and her views on why maternal health, the gaps come from a very deep-rooted, subconscious even practice in our healthcare system that is very created for a certain type of patient and not for all. One of the things that she talked about was sometimes language barriers due to this very rushed, we need to get to the next kind of patient kind of situation. The appointments sometimes can be very, very rushed, and there is a lack of pause to actually meet the concerns of the patient. So she said this much more beautifully than I'm saying it. So I'm quoting from the article. They may unintentionally rush a visit and miss key information that could have opened a conversation about symptoms. The system itself presents problems without implicit bias, but implicit bias increases the gap, which must be addressed. So beautifully. The next portion of the article talks about addressing the gap. What is the gap, right? So she says, for starters, we need to expand the model of care across the continuum of reproductive health, not pigeonholing care into the annual pap smear and the 6-week postpartum visit. Reproductive health gets cornered into what Dr. Howell calls touch points throughout a woman's life. I cannot agree more. Reproductive health is so complex, and yet most medical professionals or marketing and branding towards reproductive health is just like birth, pap, and postpartum. That's it. She goes on to say, watering down reproductive health, like birth control, pregnancy, and birth is oversimplified at best. Period health, endocrine disorders, emotional and mental health well-being, pregnancy, and postpartum are all part of the complex, nuanced topic of healthcare. So I cannot agree more with that statement, right? So we miss the mark when we don't include pregnancy health. We miss the mark when we don't take into consideration hormonal health, emotional health, spiritual health in the complexity of women's care, okay? She goes on to this next section called Contraception and Race, which was really interesting to me, which was really, really profound in a variety of ways, right? She really emphasizes fertility awareness educators and how it can really empower women, especially women of color, in understanding their bodies to make informed choices. That is exactly what 3W is trying to do. From the very beginning, we did not want to include, in my opinion, contraception because it is not only a Band-Aid approach to what's actually happening in women's bodies and women's reproductive health, but it doesn't get to the root problem, right? Our bodies are amazing. It's constantly trying to tell us something. Our periods are our 5th sign. And if we take all of that into consideration, why are we contracepting? To either mask the problem, to either gloss over the problem, to either say like, that's just something that you're going to have to live with for the rest of your life. No, there's a deeper rooted issue that we need to address. And interesting enough, this author is saying contraception and racism go hand in hand, right? So interesting the way she kind of talks about it. And there's this article in the New York Times called The Dangerous Rise of the IUD as Poverty Cure. Super interesting article. If I read it myself, it really kind of was like, oh my gosh, light bulb moment for me in why I've always been so skeptical of birth control or contraception as a whole, right? With someone personally, for myself, with someone that has struggled with heavy periods, painful periods, debilitating periods where I would miss out on life, for 2-3 days, curled up in a fetal position at home in the dark on my bed, missing out on, just life. And having medical professionals tell me that, oh, just take this pill, it will make all of that go away. I knew it was not the right thing for me. And Thank goodness my periods have gotten better as I've gotten older. But during that time of very formative years for me, right? Like e- e- for a medical professionals to say this is your period is painful and this is just your life now, it was just never good enough for me, and the approach of contraception was never appealing for me. And I think more and more women are pushing back. More and more women are saying, yeah, my body's trying to tell me something. I really want to honor it. Really want to honor that voice that's screaming at me. And then now this piece of this author connecting contraception to this cure for poverty. Our society constantly is trying to find this quick fix, and we don't want to do the hard work. We don't want to do the internal conversation about, like, why is it that I'm in this position? Why is it that there are these issues that are coming up, and really facing those issues head on? We like to gloss it over and find that magic pill. And what this author is trying to say is, like, contraception is not actually the answer to the maternal health gap issues that we're facing. In fact, it only adds to the maternal health and reproductive health issues that we're facing. She really emphasizes, like, fertility awareness based methods, which at 3W we have a wonderful program, like you've heard us talk a million times about FEM, fertility, education, and medical management. That's why we're such big advocates with our patients and empowering our patients to find more about what their bodies are actually trying to tell them versus masking it with this magical pill, right? This author here, I'll quote her. So, today we have fertility awareness based methods that by design put the patient in the driver's seat. Perfect how she said that. Prioritizing fertility awareness education for communities of color, and more importantly, by women of color, can empower non-white moms and their feelings of fear, uneasiness, pressure in their doctor's office, ultimately leading to more positive outcomes for mothers today and their children tomorrow. So beautifully stated. So as we unpack the maternal health gap, which is a glaring problem in our country, what do we do? How do we continue to have this conversation? How do we continue to educate ourselves and educate other women to take control of their healthcare? And what she said is the shift in healthcare systems from sterile doctor offices to more holistic views, including mental and emotional well-being, are signs of positive change. When I read that, it was such an affirming message to me as one of the founders of 3W, because if you've ever been a patient here, if you've ever given us a shot at addressing your healthcare needs, I hope you could see that we're approaching it in a holistic way. I hope you're seeing that you're not walking into some sort of very sterile machine-like space that's going to treat you like a number, or you come in and you come out and it's just this very transactional relationship. We're more than that. We're here to really serve women from a much more holistic and community-based, peer-based type of care. And if you have been curious about us, if you are looking for something like that, I hope you can give us a shot, because this is exactly what we've been trying to change. And quite honestly, when Melanie and I started this clinic and this idea of it, we did not know that it was going to turn into something like this. And thank goodness, by design and by listening to the community and by understanding the community and the women that have walked alongside us to mentor and coached us, it has shaped 3W into what it is now. And hopefully we're standing in that gap. We're standing in that maternal health gap that's so glaring in this bigger medical system that treats women as very transactional, robotic. We're different here at 3W. And I love how this article addresses and really opens this can of worms and go, racism is a part of this gap. Contraception adds to the gap. Financial barriers, communication barriers, treating people like they're disposable are all parts of this maternal death development in our country, right? And she ends by saying, the situation in which we find our nation is multi-layered and complex. Yes, couldn't agree more. With knowledge and proper motivation to improve the situation for ourselves and our sisters, change is possible and powerful. And I just want to reiterate that I hope that 3W is a part of that change. In fact, I know time and time again that when a patient comes here and they get to experience our care, they get to experience the type of different approach to reproductive health, that we are filling that gap. We are standing in that gap and saying, we are going to fill that gap in a very intentional way. And one person at a time, we hope that will change, alter, make better someone's life. So anyways, I wanted to get on this podcast, shout out to this amazing article that was written. And again, we're just touching the tip of the iceberg, right? There's so much more layers and complexity and conversations that we could have about maternal health gaps and maternal death rates in the US. I hope that our donors, our listeners, our patients out there know that 3W is trying to fill that gap as best as we can. And for those of you that has donated to us, that have supported us through the years, that has trusted us with this mission to filling that gap, we might not be perfect at it because it is so complex, but we are trying our best to not add to the problem. And just really beautiful article, really hit a lot of points that I really resonated with it, and really encourage all of you to read it yourselves, because there's a lot more that I didn't go into. But thanks for joining me today. Thanks for letting me kind of process and talk through this article that I felt very connected with. And yeah, just hope you're having a beautiful week, and happy Thanksgiving to you and your family. Thank you so much for tuning in. Bye-bye. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.